Hello and welcome. I'm Margaret Scott. I'm in New York and the rest of our panel is in Southeast Asia. Thank you for joining us. I'm with the New York Southeast Asia Network, and it is a virtual network started by academics and journalists and scholars in the East Coast of the United States to put Southeast Asia in the conversation. And this panel tonight is an example of our virtual network. It is a collaboration with the Foreign Correspondents Club of Thailand and with the ISIS at Chulalongkorn University. And I want to give a special shout out and thanks to Dave Foster and his team for technically putting this together at Jayan Media. And without further ado, because you've all seen who's on the panel, I'm going to start. The order will be Dean Danny Quah, who's the Lee Kuan Yew's School of Public Policy Dean, and next to Michael Vatikiotis, a well-known journalist and humanitarian dialogue expert. Then we're going to move to Gwen Robinson, a very seasoned and long-term journalist all over the world, especially in Southeast Asia. And last to Professor Thitinan Pongsudhirak, who is with the Institute for Security and International Studies and one of the wonderful co-sponsors of tonight. So thank you all for joining, and Danny, over to you.
Thank you, Margaret. And thank you all for joining us. It's a great pleasure to get to speak to you. I thought that in the time I have in the opening, I would make 3 points. The first is what the gravest dangers on COVID-19 are. We're here to talk about what happens after it, but we mustn't forget what it is. The second point I want to make is my task here is to talk about Southeast Asia as a whole. So the second point I want to make is a very quick overview of the dynamics around Southeast Asia on COVID-19. The third point I'm going to make is to try and bring out where we go from here. Some of what I'm going to say will be in disagreement with my fellow panelists, but that's the point of having this discussion. So to begin, we are all now used to the idea of waking up every morning, going over to our favorite world information website and tracking that as of today, COVID-19 has infected 8.2 million people. It has killed over 440,000. It's gotten so that these numbers, we've become desensitized to them. Every day we see another digit flip, and these numbers are so big, we have lost sight of what they mean. So we need to think back how in early reports on COVID-19, what we worried about was the fact that national healthcare systems could be overwhelmed. What did that mean? Hospital beds might be insufficient. Respiratory ventilators were not going to be enough. Nurses, doctors, frontline workers were going to succumb, exhausted, without personal protective equipment. People would be falling ill in hospital hallways, in the streets outside. They would be dying without treatment. Public healthcare system would be overwhelmed. It would be the zombie apocalypse. Without the zombies, without clarity about how exactly we overcome this. Now, to be very clear, there is no good time for a disease like COVID-19 to run rampant around the world. But arguably, 2020 has been one of the worst possible moments in recent memory for us all to have to face something like COVID-19, because we remember pre-COVID-19, life wasn't a bed of roses either. The world was already facing 4 large disruptions. The first, great power geostrategic rivalry. Yes, US-China competition, but everybody else getting dragged into it one way or another. The second, rich-poor income class confrontation. The clarion call for how income inequality had gotten so high, social mobility had declined, something needed to be done. We were on the brink, in some places, of class warfare. And while it might not have manifested as that, together with geopolitical rivalry, led to the emergence of a nationalist populism, a very dangerous nationalist populism around the world that got in turn tied to a move that already in place even before then of deglobalization. Humanity no longer being satisfied with how globalization offered the promise of making available to every one of us in short order anything that was available to anybody else on earth. We were tired of that because we thought that process was destroying industry, stealing jobs, making all of us lose our identities. So as if these three large forces weren't enough, hidden away in there was a rising disdain for science and expertise. All of us can remember how in the Brexit debate, a politician got up and said, the British people, we've had enough of scientific experts. We mustn't forget that in 2019, the world, before the World Health Organization got caught up in a politicization over the coronavirus, the World Health Organization announced that one of the gravest public health threats facing the world was the anti-vax movement, vaccine hesitancy, people who had grown suspicious of what vaccination did to their offspring and were no longer allowing the offspring to be vaccinated in a way that the World Health Organization thought to be sufficiently dangerous to the public health around the world. Now, with all this as background, COVID-19, well, it provided a blank slate onto which humanity could write the worst of its fears and the most egregious of its instincts. When that got tied up with Wuhan, China, the clarion call of how state control of information and citizens were disrupting a global public health response in parts of the world, foreign migrant worker dormitories becoming hotbeds for COVID-19, deglobalization, supply chain weak links being rethought, the reliance on China as the manufacturing factory of the world being re-examined, politicization of the coronavirus with the World Health Organization now itself in the crosshairs. It was not a good place for us to be at. COVID-19 accelerated, fast-forwarded many of the worst of our instincts. That's the background. What happened in Southeast Asia? Well, in Southeast Asia, many of us had experience with SARS, we had experience with H1N1. There was a playbook by which many Southeast Asian nations knew how to, had put together to try and deal with this kind of epidemic. So a number of countries reacted very quickly. Singapore, where I live, is one of them. Vietnam was another. These two nations immediately put in place epidemiologic safeguards. There was constant emphasis on contact tracing, on quarantine, isolation, distancing, on testing and healthcare. And some Southeast Asian nations did a remarkably good job of keeping low fatality rates, keeping under control the infection. In all Southeast Asian nations that were successful, in fact, in every nation that's been successful, from New Zealand on through other parts of the world, what we found important was social distancing. What we found important was well-performing, trusted bureaucracies. What we found important was strong enforcement capabilities that could enforce the safe distancing measures that were needed, because it was only with that we were able to get COVID-19 under control. And dismal as the websites are that report numbers on COVID-19 infection and deaths, it is actually quite remarkable that nations that are not remarkably well off, that you wouldn't have thought had well-developed public health systems, actually the nations in Southeast Asia have done a remarkably good job of keeping this under control. There are, of course, question marks and asterisks and footnotes that you have to put to that. Singapore had remarkable initial success, but then we were caught up in a sequence of large infection numbers that appeared among the migrant worker population. In the event, these latter turned out to be asymptomatic in many instances. The infections were mild. Public health infrastructure was not overwhelmed. Among the more vulnerable segments of the population, infections were kept within single digits on a day-to-day basis. It's true when you read the global press, it seemed like Singapore had thousands of infections a day. But again, a lot of that was asymptomatic and mild. But I leave this quick survey of what happened across Southeast Asia, and we can get into details about what happened across the different nations, but with one, for me, useful lesson. And that is across all of us, including New Zealand, which has been very successful, we need to be constantly mindful of potential blind spots. Singapore had the infection rates under control. Through contact tracing, we knew everything about what happened with the handful of people who actually were infected. But by the time we got a second wave of people coming back to Singapore and a third wave among the 700,000 migrant workers that we had, we were fortunate that we still knew how to deal with this. Many other nations who might at this point be congratulating themselves will need to be looking out for situations where a second or third wave could emerge. And the second or third wave has nothing to do with foreigners, it has nothing to do with construction workers. What it has to do is with people living in close proximity, which means Brazilian favelas, public housing, prison populations, US aircraft carriers, gated communities, old people's homes. All of these are things that around the world we need to be mindful of. Let me finish up with my third point. Southeast Asia, how do we move ahead? It used to be, time was, that Southeast Asia, in fact, everywhere in the world, we looked to a number of great powers in the world, politically powerful, for leadership in all kinds of global emergency. The United States was the benevolent hegemon. One of the great dangers of this world that we're navigating now in the face of this terrible pandemic is that US leadership has left the building. The United States faces internal strife. It has no appetite for multilateral collaboration. It is dealing with great power rivalry across the other nations that could potentially be leaders in this global reaction to COVID-19. So Southeast Asia now needs to take, if not leadership, at least initiative. Initiative along three fronts: maintaining international trade, keeping lines of international finance open so we can do risk sharing and work through rational ways by which we work down the immense public debt that many nations will have accumulated through this process. We need to work out systems for regional public health. We need to be nimble in how we recover international travel and tourism. We need to be mindful of the dangers of third and fourth waves. Then my last point about what we do in Southeast Asia is to try and look ahead to the changes that are going to come. And I end with this. There will be lots of changes that the world needs to do. Business will not, as far as everybody who studied the numbers, studied the science thinks, go back to what used to be the usual way. We will now have safe distancing. We will now be more careful about different ways in which crowds get together. Those industries, those economic sectors that rely heavily on crowd density will need to rethink their way of business. Let me end with three, again, final points about looking forwards for Southeast Asia, but also for the world. The first is that we need to rethink the mad pursuit for economic efficiency. We need to stop fetishizing the way in which superstar winners emerge from squirreling away all the gains from trade to be made, all the inefficiencies in the system. What we need to think about are systems that are resilient, that keep the weakest links strong. The second thing to remember about transformation in Southeast Asia, actually and anywhere else in the world, is that we will need to fast forward transformations in digital infrastructure. One of the things that has actually saved economic activity in the COVID-19 pandemic has been our ability to be able to conduct valuable economic, intellectual, scientific transactions via purely digital means, whether that's telecommuting, telemedicine, or a whole range of other things. This spread of a digital infrastructure will, in addition, reduce income inequality because they make economic activity more accessible, whether you live far away from a center or whether you live close to the center. And that leads to my final point, that the COVID-19 pandemic will teach us to be less obsessive about concentration in super cities. We used to say that for economic activity, geography was destiny, because by moving from rural areas to the big city, bright lights, you enriched yourself, you increased productivity in your nation. But actually, it's not geography. It was never geography that we were drawing on. It was density. It was people working close together, throwing ideas off each other unexpectedly and serendipitously. People working cheek by jowl, elbow to elbow. That is going to be no longer on offer. It was actually not geography that was destiny. It was density that was destiny. And we need to work out ways by which we no longer draw on highly concentrated super cities to make our way in the world. I look forward to the conversations that will happen. Let me turn my time back to Margaret. Thank you for your attention.
Wonderful. Thank you so much, Dean Quah. You raised a lot of extremely interesting and important points that I hope we probe more. Michael Vatikiotis is going to also be talking a bit regionally, and I wonder if he shares, Michael, whether you share Danny's optimism about the way Asia can work together. The track record is mixed. And also, I hope you will tell us, and I think you will, besides the possibilities of cooperation and what it would look like, there's also the possibility of emerging conflicts. So with that, Michael Vatikiotis, over to you. Thank you.
Thank you, Margaret. It's very good to see you. I suppose, yes, I mean, I'm always an optimist about Southeast Asia in particular, but I want to focus initially, and I'll come to the optimism later. I want to focus initially on the impact of the pandemic, or rather the lockdown measures and their economic fallout on democracy and conflict in the region. Broadly speaking, the pandemic, I think, has been good for conflict and bad for democracy. Government responses to the pandemic have, I think we've seen around the region, utilized the tools of top-down authoritarian rule, because these are the tools that everyone reaches for. They've indicated primarily the inherent weakness of democratic rule across the region, and more importantly, the frailty of civilian supremacy over the military. Indonesia, for instance, which everyone has been very optimistic about in terms of its sustained democratic transition since 1997, immediately turned to the military to lead on managing the crisis. The head of the crisis management team for COVID-19 is a former special forces officer. He had headed up the disaster management team before, and the closest advisors to the president of his time are all not just military officers, but former special forces officers. Thailand used emergency decrees backed by military power, and that's because the government of Thailand is essentially a junta-based government that is derived from the 2014 coup, even though they were seemingly re-elected or elected in the 2019 election. And there's been a tussle in Thailand between the technocrats in the shape of the medical teams who seem to know what they're talking about, and the military who would rather just use the tools of control. Myanmar's crisis response was also led by the military. And yes, There have been civilians involved in the response, but it's the military that dominates the crisis response. In the Philippines, President Rodrigo Duterte all but threatened to declare martial law and deployed the military to enforce the lockdown. In some countries, like Malaysia, where the military isn't a factor, the lockdown has been used to keep a lid on protests and delay democratic accountability. The Malaysian parliament has not met properly since March and is unlikely to meet to debate a no confidence motion in the government until July, if not August. Now, countering that to some extent has been, I think, something of a pushback in the last couple of weeks, which strangely enough has not been derived from the COVID-19 crisis, but has been very much on the back of the Black Lives Matter movement in the United States, which has given impetus to NGOs and civil society to advocate for equal rights, greater tolerance, and even, in the case of Philippines and Thailand, on human rights. As far as conflict is concerned, as I said earlier, I think the COVID-19 crisis has been good for conflict. Whilst there were promising signs of a ceasefire in all the subnational conflicts around the region, to begin with, for instance, unilateral ceasefires were declared by the armed ethnic organizations in Myanmar, in southern Thailand, and in Papua. And in the Philippines, a long-running communist insurgency was halted in April by a bilateral ceasefire declared by the government of the Philippines and the New People's Army. Now, the only one of these ceasefires that's really held up was the one in southern Thailand, which has been in place since April. And it's unilateral, and the Thai government has not responded in the same way. And there has been no violence perpetrated by the Barisan Revolusi Nasional, the only effective insurgent group in southern Thailand since April. In Myanmar, the government refused to reciprocate the offer of a unilateral ceasefire by the Arakan Army in Rakhine State and two other ethnic armed organizations on the other side of the country on the Chinese border. Fierce fighting has continued in Rakhine State, and to this day we now see more than 160,000 IDPs, 160,000 people made homeless by the fighting, which is particularly fierce in the northern part of the state up against the border with Chin State and Bangladesh. In Papua, the government hasn't responded to the OPM, that's the one of the main pro-independence armed groups in Papua, who offered a ceasefire in April, and the government never responded. And in the Philippines, the government abrogated the ceasefire soon after it was declared and has gone on an aggressive campaign to hunt down communist insurgents. So in many ways, what we've seen is we saw an initial response in response to the UN Secretary General's call for a humanitarian ceasefire across the region. A lot of these ceasefire offers were, I would say, rather opportunistic, a little bit cynical in some cases, and they were mostly unilateral. But by and large, these conflicts have also managed to continue without being badly affected by COVID-19. COVID-19, as we've seen, is mainly an urban-based, to refer back to what Danny was talking about, densely packed. This is going to affect mostly urban society. In Rakhine State, for instance, there have been very few cases. There is, of course, concern in the community about COVID-19, but by and large, the conflict areas themselves have not been badly affected. I suppose southern Thailand is something of an exception because there was a cluster of people who returned from religious gatherings in Malaysia early on in March, and there were sort of several serious clusters of COVID-19 in southern Thailand. So the conflicts themselves have rumbled on. Governments have been very distracted by the need to address the health crisis, and therefore peace processes that have been underway in Myanmar, in Thailand, and in the Philippines have largely fallen by the wayside. So it's a combination of the conflicts continuing and also governments at a high level very much distracted and unable to focus on conflict peace processes that may be addressing the conflicts. To go back to the overall political situation and maybe to address the point that Danny made about recovery, I mean, clearly we are going to see a huge economic impact on the region, and those of us who were covering this region in the 1997 financial economic crisis probably thought at the time before the crisis ended that there would be a serious long-term impact on Southeast Asian economies, which didn't turn out to be the case. And there were two reasons for that. The first reason was that many people who had thrived on the informal economy in the urban areas and the formal and the go-go economies of Thailand, Indonesia, Philippines, and Malaysia, and so on at the time, were able to go back to rural economies and be absorbed to a large extent at that time. And this is not the case this time. The rural economies of mainland Southeast Asia, at least, are not in good shape. There is an extended drought in Thailand, in the Mekong Basin, and the absorptive capacity of rural areas is not as great. Also, you have a much higher level of migrant labor across the region, and they've been basically told to go back to where they came from. And so you've had a lot of dislocation and disruption. There are up to more than 1 million Indonesian workers in Malaysia who've been trying to go home, have been told to go home. There are 800,000 unregistered, undocumented Filipinos in Sabah in East Malaysia, 3.5 or 4 million migrant laborers from Myanmar in Thailand. And so that dislocation, social dislocation, they don't have homes to go back to in the countries they're in, and they have to cross borders, has been much greater than I would argue back in 1997. And the second reason why the parallel doesn't quite work is because back in 1997, most of these economies had fairly healthy reserves and balance of payments. There was prudent economic husbandry in countries like Thailand, which meant that it was easy to recover. But now we see a situation where Thailand hasn't quite recovered fiscally in terms of its debt from the 1997 crisis. And now it's hit with the crisis today, and it's going to be much more difficult to recover. In Singapore, of course, has spent 100 billion Singapore dollars and has got 300 more to go in its reserves. So it's not so badly affected. But I think we're going to see other countries in the region, and perhaps this is something that others can address later on, hit by much more long-term economic hardship because of the extent to which the economic crisis to come after the pandemic will hit these countries and be longer lasting. So I'll leave it there. As I said, I think it's been good for conflict, bad for democracy. There's some hope in the way that the events in the United States and rippling across the rest of the world, demanding equality and tolerance and freedom. I think that's a ray of light at the end of this pandemic crisis, and not driven by the virus itself. And that's something perhaps we can talk about as well. Thank you, Margaret. I'll turn it back to you.
Wonderful. Thank you, Michael. Again, another layer to put on top of Danny's great remarks. And now Gwen is going to actually delve into something that we haven't talked about as much yet, and that is the most vulnerable. There are, besides migrant workers who are definitely a vulnerable class, there are many others. And so Gwen, the president of the FCC Thailand, organizer of tonight's panel, and longtime journalist. Thanks, Gwen. Turn on you're muted. Gwen, you're muted.
Thank you very much.
Great.
I do that all the time. I'm sorry. Thank you, Margaret. And I just wanted to say I feel honored to be on such a great panel, and I found the remarks by Danny and Michael really give us great food for thought for further discussion. I'd just like to make the point here that I wear a couple of hats. So I've been doing a lot of research lately as a senior fellow at ISIS, the Institute of Security and International Studies, with Dr. Thitinan on the panel, but also reporting for the Nikkei Asian Review, and have recently been interviewing a lot of workers and other people that you could consider the most vulnerable in this post-COVID situation here and elsewhere in Southeast Asia. I think the most striking thing I'd like to say about and I think we can call it a post-COVID phase or a COVID transition phase at the moment, because you might be aware that Southeast Asia has gotten off what might be seen as very lightly, and Thailand has been one of the great success stories in the region for containing the virus with little more than 60 deaths and just 3,000 or so infections, while Vietnam is virtually zero, and so on. Some other parts of the region are not so lucky, but they're all contending, I think, with the issues that I'm talking about, which is the impact on the most vulnerable. So I think the most striking thing to me is how the countries, some of the countries in this region that took the hardest decisions and, you know, possibly as a consequence had the lowest incidence of COVID-19, have really clearly been paying the highest price economically in terms of economic contraction, job losses, capital outflows, and the impact on the bottom rungs of society, the most vulnerable. And I think, I hate to say it, but I think Thailand, which was just the greatest tourism success story, great magnet for foreign investment, etc., is probably the starkest case in point to illustrate some aspects of the impact of the post-COVID and COVID lockdown measures, particularly on the most vulnerable, and can give some insight into what's going on in other countries of the region. So out of a population of 70 million people in Thailand, I think more than 40% of jobs in a workforce of about 37 million are considered threatened in one way or another as a result of the pandemic, or at least the lockdown measures. And like some other countries in Southeast Asia, the reason that Thailand has been so hard hit is partly due to its dependence on a handful of key areas. But Thailand, more than all the other countries, its inordinate reliance on tourism, which basically accounts for conservatively 12% of GDP, but most economists will tell you it's easily 20% when you take into account the support industries that depend on tourism, everything from agriculture to the gig economy. And then also basic manufacturing, completely reliant on exports, and agriculture. These are all areas badly hit by the pandemic, agriculture because of commodity prices and so on. Worsening the situation, particularly for Thailand, and Michael touched on this, pre-existing circumstances such as the growing drought, which has driven many farmers into destitution in the north and was kicking in very badly way before COVID reared its ugly head. And an overall slowdown due partly to some dysfunctional politics, elections, and also the US-China trade war, which has had some serious effects, I think, in the region overall. And many jobs in these sectors I mentioned and beyond are what you call informal. They are piecemeal. They include a lot of self-employed workers, gig economy, day laborers, agricultural workers, and related to tourism, but frankly, by no means dependent on foreign tourists, is the vast sex industry in Thailand, which, the estimates vary from 100,000 to 1 million. It's somewhere in between, but it's clearly a sizable contributor to the economy. That has been, lockdown has hit all these sectors, particularly those kind of sectors, and tourism, where, as you may know, Thailand abruptly closed its borders and has maintained virtual isolation for quite a while now, more than 2 months. So, those kind of measures, helped the economy a lot. Helped Thailand avoid the worst of COVID. It could also have been, as I think Danny touched on, it could be something to do with heat and humidity. But anyway, there you have it. It has emerged almost unscathed from the actual pandemic, but it's probably the worst economic victim. I spent, as I said, some time interviewing people hit by the lockdown measures, and I've been working with colleagues in regional countries to try to get a snapshot of the impact on the most vulnerable. And we've concluded that alongside tough decisions to lock down, I think many governments in this region, and particularly the Thai government, announced some very big spending packages for emergency relief payments, as well as subsidies to industry, tax breaks, etc., and a host of programs in the hope that this would offset the impact, particularly when it comes to the most vulnerable. But here, like in many countries of the region, it is really clear it has taken way too much time to get funding and relief through to those bottom layers of people. I can go into it later, maybe we can discuss it, but programs to apply for some relief funding in Thailand are available here only by applying over the computer, internet, mobile phone. I mean, there actually are quite a few people in Thailand who don't have computers or internet access very easily, or don't understand how to upload and download documents. So I think that has compounded this situation. And what we're seeing now is a real surge of, for example, food queues all over the place. There are many. It is unthinkable to see in this country, which has become a middle to, I think, upper middle income country in recent years, food queues all over the city, big NGOs springing up, sending packages out all over the place. There is a real sense that the vulnerable are in crisis. As well, it should be mentioned that migrant workers are a big part of the economy here. The estimates are into, I think, around, I'm sure Dr. Thitinan can correct me, but I think there are about 3 million and possibly more from mainly Myanmar, Cambodia, Laos. And migrant workers have also a difficult status here. Many have documentation, many don't. And they are largely falling between the cracks, as are, as I mentioned, the sex workers who are technically not eligible for these relief payments. I think a very interesting point that is a real problem, I think, for governments is working out how to get these relief payments out, but also who should be eligible. This is a good example. I think in Thailand it was announced that the government would give 5,000 baht, which is about nearly about $170 relief payment per month for 3 consecutive months to people who were in crisis, who had lost jobs, etc. They were completely taken unawares. 27 million people applied for that program. And in the initial weeks, the government was just forced to announce that it could not deal with that number and it would massively scale back that program. There was, ups and downs and stops and starts, and they eventually arrived at a number, I think, of about 14 million. And that program is supposed to have kicked in about 2 months ago, but I've been interviewing people as of 2 weeks or 3 weeks ago who are still to get payment. And we think at the moment there's probably about 4 to 5 million people who've received the first month of payment. There's a lot of need out there, and there are concerns that the next phase could see some really serious distress in the most vulnerable sectors. And I think all the big agencies, IMF, World Bank, and UN agencies have been warning about this situation. So I think that kind of sets the scene. And what to do about these sort of things. I mean, we could go on about, and I know my fellow panelists would probably have more insights into other countries of the region. I can say, though, that, looking around in Cambodia, Indonesia, Myanmar, these are all countries with similar economies, with a lot of 60% or more informal workers who are not really in the formal economy, and many unrecorded. And they all all these governments have a problem about what to do next. I think there's a big lesson here, not only about rethinking policies, for example, social safety nets and things like that, but also how you deal with this whole issue of identifying the right people and getting the right kind of help out there. So I'm happy to come back to that, but I will leave it at that for now.
Great. Thank you very much, Gwen. Yes, nobody's touched on in the delivery to people hit by the pandemic, the way it combines with the record of corruption in many of these countries and what's going on,
Yeah.
particularly for the most vulnerable. So maybe we can get to that in questions, but thank you. And now we come to Professor Thitinan Pongsudhirak, and he has the wonderful job, and he's very good at it, of pushing forward from where we've been so far in this panel. And then to push it out, two things I'd love it if you would talk about is, do you agree with Michael that this time around is much worse than 1997 to get out of? One. And two, how is it going to affect the region, particularly in light of Southeast Asia has long been the arena for US-China rivalry. And now we are seeing the pandemic is absolutely complicating what that rivalry is and where it's going. So if you could touch on that, I'd be very grateful. And I turn it over to you. Thank you very much.
Okay, thank you, Margaret. And greetings from Bangkok to our viewers. I just want to say as a preface, this is a combined event, combining forces of the New York Southeast Asia Network, the Foreign Correspondents Club of Thailand, Institute of Security International Relations, International Studies of Chulalongkorn University, ISIS Thailand. Our tech team is supported by Frederick Naumann Stiftung, the Frederick Naumann Foundation. So, thanks for tuning in. This is let me just address Michael's point first, and then I'll come back to my three main points about COVID-19, about the US-China international scene and setting and geopolitics, and then finally about Southeast Asia, ASEAN, how we're going to navigate the way ahead. First, 1997, 1998, as Michael Vatikiotis mentioned, this is a different kind of crisis. I mean, the 97, 98 for Thailand, the epicenter, where it started in July 1997, it was the first time, before that, for 3 decades, Thai economy expanded 6% a year, 6.2% a year. But 1997, 1998, big contraction year on year. But back then, the agriculture sector was 40%, they can absorb a lot of the jobless people who lost jobs. A lot of finance companies were closed, security brokerages. So there was a cushioned, a sponge that can absorb for a time the workers, people who suffered the hardships. They can go back to the countryside because many of them came from the countryside. Now this time, the agricultural sector is about 28% now. I know a lot of people who suffer from this pandemic, COVID-19, who didn't go back to the countryside. They had nowhere to go back. So they stayed around, they stuck it out. And now they finally, thankfully, are resuming their jobs and their livelihoods. So very different than 1997, 1998. I think there has been a recovery since then. So, the macroeconomic accounts, the balances are very much in the black. I mean, you have, Thailand has a record high international reserves. Back in 1996, 97, it was just 30 billion, barely to cover 6 months of imports. This time, too high even, people say, because the baht is so strong. So very different kind of macroeconomic conditions compared to then. And most importantly, 1997, 1998, the international economy, the world economy, the developed countries, the markets in the US and Europe and so on, they help lift up the Thai economy during recovery in the late 1990s under the IMF program. So by the early 2000s, we saw a pretty strong recovery. In fact, the recovery has been so strong and robust that we now have, maybe people even say it's too strong. The baht is too strong. We have a current account surplus, trade account surplus. So in fact, it's gone in reverse, gone the other way. Now, this time, the virus, the pandemic this time, it's not just a financial sector. It's not just a macroeconomy. It's everybody. So I think this time we will see, a contraction that we have not seen. In 1997, 1998, we had a 2% contraction, and then another 8% contraction. This time, maybe the IMF says maybe 6.7%, the World Bank says maybe 5%, others say maybe 6, 7, 8%. So certainly a contraction, not as severe as 97, 98, but there's no global uplift from the world economy, from the US, from the EU, because they also suffer. So now I think we have to find ways to grow. And this is not just for Thailand. Every economy has to fend for itself. The bigger economies have a bit of an advantage because of bigger domestic markets. China would be the leading one. But Thailand has a critical mass, 70 million, with mainland Southeast Asia. Maybe that's something we can work on. But this is also a point for ASEAN as a market. ASEAN can also help itself by turning within the region, because I think there's going to be more deglobalization, and you cannot depend on world markets as much. So I'll come back to this point about ASEAN. But now let me go back to the my three main points after addressing Michael's mention about the 1997, 1998 compared to 2020, 2021. COVID-19. The coronavirus is deadly. We must not underestimate. We still don't know fully what's happening. We know infections, we have the death toll, we have the table of different countries with different numbers and so on, but the virus itself is potent, and it still has a long way to run. It's going to have its run. It's got a lot of legs. I'll just it's not something I want to make a light note on. And there are now second wave in maybe some clusters in China. Second waves elsewhere. Singapore has seen some cluster. India's numbers gone up alarmingly. Brazil's as well. So we cannot be complacent. We have to be very vigilant. On the lighter side, I will say this. Co-organizing this event. ISIS Thailand, we want to add value. We want to do something that our viewers, our listeners would like to hear. That's why they like to come to our events when we had it in person. So COVID-19, I think COVID-19 is tired. There have been so many webinars, so many virtual events. And, so when this one came up, I was a little bit hesitant to do another COVID-19 Southeast Asia ASEAN. However, I think that we've done some good value adding along the way already. You can go away as a takeaway, certainly. I think Danny Quah has mentioned a point about geography not being destiny, but maybe density is destiny. So that has long-term implications about, maybe urban centers, urbanization might face a bit of a slowdown. Maybe we'll go back to a more balanced life between the town and country. We will see, but that's one takeaway. And also Michael mentioned something that we can also take away with, the pandemic, has been good for conflict in a way, has slowed it down, has tempered it, but not so great for democracy and democratization. A lot of governments have responded by imposing restrictions, stringent measures. It's interesting when the situation is calmer and it's time to lift restrictions, they don't lift everything. They keep some in place, and this is the tendency of Southeast Asian governments on the authoritarian side. So COVID-19, I think, apart from the point that it's been so belabored, we want to find something new to say, and we're trying to add some value to the discourse. I think that now we will see infections ongoing, and these infections have been priced in meaning that people have become used to living with the virus. We have precautions. So face mask. Today, I didn't wear a face mask because I don't like to wear face masks. But I felt like an alien walking around the campus, my university campus, Chulalongkorn, but also, going out for errands and so on. I could not go into a convenience store because I didn't have a face mask. So I asked, the lady to go, the worker, the cashier to go get the product for me. But we are living with it. We're becoming accustomed to it. A bit of physical distancing, a lot of face masks, certainly in Thailand, I think most parts of Asia. And then, a lot of washing the hands. And then luckily, I always like to wash my hands even before COVID-19. So I think now we will not go back to the March and April lockdowns, severe lockdowns, because people have found that, You have to have jobs. You have to take care of your health. There's a public health safety issue, but it's also an economic reality. There's a balance, there's a trade-off between infections and virus and jobs and incomes and livelihoods. So now that I think that has been priced in. So even if we see second wave, maybe even third wave, clusters and so on, I think a lot of Southeast Asian governments and societies will want to kind of find ways to still maintain livelihoods while minimizing the infections, the COVID-19, until we have medical solutions from the vaccine, from medication and so on. So I think that's something that we have learned over the last few months. March and April were very grim around the world. Certainly in Thailand, we had a Thai New Year. It's supposed to be a wet day, April 13th, but nobody was in the streets. I mean, there was nothing, no celebrations, no festivity. It was the first time in Thai history, Siamese history. So I think we've learned from that. And I think that moving forward, we will not go back to that kind of severe lockdown. There'll be some restrictions, some stringent measures, but not like that, because we've priced it in, we've learned how to kind of live with it, and there'll be a new kind of balance and trade-off. Second, I would say that, when I look at the coronavirus tracker, it's almost like a football table to me. So the number one is doing the worst because of more infections, more death, the death toll is highest and so on and so on. And Thailand has slipped down the table now to number 88, maybe like today, probably about 90 or 91. So Thailand has done well, and Southeast Asia generally has done well. And we still don't fully know why. The numbers in Myanmar are very low. We were afraid that, the Rohingya refugee camps along the border with Bangladesh and inside Bangladesh, there would be a time bomb. It was just a matter of time. In March, we thought this was going to be a disaster, calamity, but it hasn't happened. It could still get worse, but it hasn't happened the way we anticipated. And Southeast Asian numbers generally, with few exceptions, maybe some clusters or numbers in Indonesia, Philippines, but broadly, Vietnam has done very well. Singapore has had some clusters, but has been very proactive on the tracing, tracking, and the government is on top of it, even though the numbers are high. Thailand is a very low number. I mean, the suicide number is higher than the COVID death toll in Thailand. Myanmar, Laos, Cambodia. So we don't fully know why this is the case, but nevertheless, COVID in Southeast Asia has been very manageable. And now, if you look at the table, the coronavirus tracker table, the highest number is the US, certainly now India, Brazil, and a lot of European countries. So in the broader geopolitical frame, my second point is that the US has suffered a lot more than the rest, and it's suffering still. Numbers still going up, and now it's been compounded by this. In the wake of the George Floyd murder and the protests around the country. I think the protests also derive from pent-up frustrations from being locked down and COVID related, but also ingrained, inherent, institutionalized racism that's come to the fore again. So, and then President Trump hasn't helped matters by fanning the flames of discontent, polarization, playing one side against the other, and so on. So in the US, in the election year, things will get worse. I mean, they have, from afar, from outside, from way here, over here in Thailand, it looks like a civil war inside. It's in the 1960s all over again, maybe even worse than 1968 in many ways. So US suffered a lot. The EU has suffered a lot. Number is very high in key EU countries. I mean, the UK is still, has internal turmoil. So what I'm saying is the US and EU have suffered setbacks from coronavirus more than East Asia, more than China. China was first in, first out, now having some new breakouts, some new clusters, but overall, onset of recovery, resuming livelihoods, economic activity again. And this is consequential for geopolitics because, a lot of countries in Southeast Asia, we look at the US, I mean, who wants to be like America? With endless polarization and very visceral hatred. Racism is on the one hand, but also polarization, and then a very controversial president. In the election year, he has a very weak opponent, so who knows who will win. But the US not looking good. China doesn't look great. China's authoritarian. We can see, we know. I think a lot of countries have reservations about China. Some countries are more in on China than others. Say Cambodia, for example. Thailand is probably sort of, a bit tilting towards China, but still have some reservations. Vietnam certainly not. But the US, I think, has not done itself favors by having such internal turmoil, polarization, divisions, and it seems intractable. Now, this will mean that China will, it will play to China's advantage in the region and, all over the world. People look around, there's a Belt and Road Initiative. The US, interestingly, in the military realm, stepping up a lot, carrier groups. And now we've seen the US taking more measures, more operational patrols in the South China Sea, pushing back very hard in hard power. But soft power, nowhere to be seen. Very, very slow, very low, very weak. So in the geopolitical mix, we're looking at Japan and South Korea. I'm in favor personally of working through ASEAN with like-minded middle powers, Japan, Republic of Korea, and as a way of not having to side with China or not having to side with the United States. And finally, my third point, Margaret, going back to your original formulation about Southeast Asia as a battleground. It is a battleground. Southeast Asia is a nexus between prosperity and insecurity. This is a good market, a good place, and has critical mass of people, 660 million people, 3 trillion GDP. It's the fastest growing region in the world. Thailand is a laggard, but the rest are growing robustly. And overall, now I think Southeast Asia economies need to rely more on each other. There have been divisions in Southeast Asia among the ASEAN member states, but now, we're not going to see the kind of globalization that used to be. So we will see more bilateral outcomes, more regionalized outcomes, supply chains, trade. We will see even travel, this so-called travel bubbles. It's going to be like bilateral free trade agreements. So there'll be bilateral free travel agreements. These are something along the lines of, it's kind of like self-made, one-on-one. It's not multilateral. It's not globalized. So Southeast Asia ASEAN economies should be very glad that they have each other. There's a lot to build on, a lot to work on. We will see, I think, a lot of domestic pressure leading to international outcomes. So the US, I think they're going to ramp up the rhetoric against China. China also will be under pressure at home to respond to the US. So the China-US face-off is going to get worse. For Southeast Asia, I think, there's been divisions on China in particular. I think China has divided ASEAN. But now I think it takes some leadership. And I think under Vietnam's chairmanship and moving forward, ASEAN should really, really realize that if you look around the world, there's nowhere else to go. They should really be glad that they have each other, that they have ASEAN together with East Asia, some China, but a lot of Japan, a lot of Korea, maybe a little bit of Australia, a lot of New Zealand. This is where the next growth projects are gonna happen, are gonna shape up. And this is where we have to put our butter and rice. So let me leave it there, Margaret. There's a lot more to say, but I also want to leave time for questions and comments from our
Yes.
audience and viewers.
Yes, we do have a lot of questions. And my question is ASEAN up to it? You make a very persuasive case that there's nowhere else to go, but these countries have been where they are for a long time, and ASEAN hasn't been able to get it together to work collectively on an agenda that really is difficult. And this is a very difficult one, so I wonder whether they'll be able to do that. And the other thing, one question is, we've heard COVID is a health issue, an economic issue, but would it be fair to say it is a national security issue for Southeast Asia, is one question. And another one, which is to your point, Professor Kuan, Thitinan, is with the US abdicating its role as a global leader, could COVID-19 push ASEAN closer? And would it be possible to see in the future an Asian confederation? So there's a lot of questions on ASEAN. And while you're talking about ASEAN, and I want to open this to everyone, we haven't spoken enough about Indonesia. Indonesia is the largest country and it's the hardest hit by the pandemic. And Michael, your comment that it is following the footsteps of militarization of its response, I beg to differ. those are retired ministers. There's no evidence that there's active military involvement in either the politics of the pandemic or the distribution or corruption or political ramifications of the pandemic. Certainly not on the scale of the other countries you mentioned. But I'd love for each of you to weave in Indonesia in whether or not it's going to help with this cohesive ASEAN response or not. Who wants to start?
Margaret,
Danny? Michael.
I'll just say on Indonesia, I think one of the I can weave together a couple of your points there. First of all, you know, at the high level, interaction between leaders in ASEAN has been thoroughly hampered by the COVID-19 pandemic. It just doesn't work to do what we're doing now, which is to meet on some sort of virtual platform. Officials in ASEAN are used to having face-to-face talks. Leaders are used to having discussions face-to-face. And while it's been possible to hold meetings at a high level using these kinds of platforms, and I've spoken to people in Vietnam about this because they have the burden of chairing ASEAN, it just has not been effective. You simply can't have the same quality of discussion on sensitive issues of regional cooperation on these virtual platforms. And so I would argue that formal diplomacy has not completely broken down, but it is more or less ground to a halt. And the Vietnamese are very frustrated because this has been an important year for them as chair of ASEAN. And it's just not been very successful. The whole code of conduct discussion, negotiations around the South China Sea have gone nowhere. The working groups have been unable to meet. High-level discussions with China have been at the very best, what they've been able to do is to replicate the sort of the formal talking points discussions. But the real substance of these discussions are always done away from those talking points, and that hasn't been able to happen. And so the machinery of ASEAN has ground to a halt. And just to come back to Indonesia going into this crisis had a very ambitious agenda, foreign policy agenda, led by Foreign Minister Retno Marsudi, to play much more of a role as a middle-sized power, to get involved, along with Vietnam, in regional issues. And I think that's really been sideswiped. You know, a few weeks ago, I spoke to the Indonesian Foreign Ministry about Afghanistan because they're supposed to be playing a role in the inter-Afghan talks. And I was told by a very senior diplomat, look, we've been asked to source ventilators. We've got no time for the agenda that we had prepared. And so I think that it's really hampered regional diplomacy. But I do agree with Jay that, you know, this is an opportunity for ASEAN and for mid-sized powers in the region to come together. And it is a fantastic vision to have, to sort of play that role at a time when the United States is really a rather prickly one. I think there is an opportunity for the region, along with other mid-sized powers. The question is, how do you do it when you can't meet?
So, Professor Thitinan or Danny, you want to jump in here?
Yeah, perhaps I could jump in. I know Thitinan wants to go on this as well, but I might pick up on your point, Margaret, about the U.S. leadership, you know, having exited, leaving a vacuum. Can ASEAN step up? And I think here we perhaps we need to shed old visions of what we think leadership, cooperation, regional outcomes looks like. For good or bad, for the last 70 years, because of overwhelming US supremacy in almost every dimension, the whole world was happy that the United States was the benevolent hegemon. And the whole world was fine with the United States sailing in with the Seventh Fleet and fixing things for us. But that supply of leadership is no longer forthcoming. America is not minded to undertake multilateral initiatives. It is not minded to look at the rest of the world and try and do good things in the rest of the world. It is, it is, as Thitinan described so vividly, overwhelmed with internal strife. Let's let America have a bit of time to itself. Let it figure out the issues. Let's not ask it to solve the problems that the rest of us now need to. If supply is not forthcoming, but demand remains high, we're just going to have to look elsewhere to try and fix these problems. And when we do that, I think we need to forget about the idea that there's one overwhelming power, whether it's the United States or ASEAN or China or anybody else coming in and fixing all of the problems for everyone. Let's break down what problems we're trying to solve. If we're trying to solve problems of economic recovery post-COVID-19, this does not call for an aircraft carrier to sail up the South China Sea. What it calls for is technocratic expertise in building, yes, travel bubbles, in writing the rules for digital trade, in writing the rules for confidentiality, privacy, data sharing, in writing the rules for keeping international trade open, in writing the rules for risk sharing in regional finance. None of these things requires overwhelming supremacy in military, technological, diplomatic, soft power. All it requires is a coalition of the capable and of the willing. And I think if we reduce our ambitions that way, sure, ASEAN or ASEAN +3, ASEAN +6, ASEAN +N can step in and solve these technocratic problems. That's all that we're asking for in this new era of leadership. Let me leave my answer as this and come back to some of the very interesting discussions, if we have time, on democracy, the military, and other things. But let me leave ASEAN and the United States as saying that I am optimistic. Let's scale down the problems to something manageable, and let's let technocratic expertise as well as regional self-interest take over. Let's forget about the idea of there being a regional or global hegemon that will form leadership. Back to you, Margaret.
Kun Thitinan, if you want to add, and I'm just wondering if any of you think, along with your question, is this an opportunity to really start getting better governance to address the inequalities in the region so that the people Gwen is talking about may actually get some help from the states where they live? But still, to ASEAN, Professor Thitinan, if you want to.
Let me just build on what Michael said. I mean, he has a good point that ASEAN diplomacy is private, is privately led. They are famously known for making major agreements on the golf course, at the karaoke halls, and having music and drinks, and on the sideline meetings. So when you don't have these actual in-person meetings, for example, they're having a summit. There's an ASEAN summit coming up in next week. It will be a virtual event, but this dilutes the ASEAN ways of doing things. So I do think that the virtual world and means have limitations, and ASEAN has suffered for it. At the same time, if you look at the authoritarianism, if you look at the spectrum, COVID-19 has been a boon in many ways to the ASEAN, Southeast Asian governments. Thailand has had an emergency decree still in place, even though conditions have improved. Philippines, you look around the whole region, even more democratic Indonesia, there have been some creeping authoritarian practices. So I think that overall, we're seeing more authoritarianism on the uptake from COVID-19. It has exacerbated or compounded pre-COVID-19 trends, and this is not going to play out well in Europe and in North America. And I think China is going to kind of benefit from this a bit. The US has not come to meetings with ASEAN leaders, right? So the US, both President Trump and Vice President Pence, missed the last summit, the East Asia Summit last year, and they were going to have a rescheduled US-ASEAN Summit, but because of COVID, it was canceled. And now, this year, election year, we will not see them. Trump, Pence, nowhere to be seen. So this is consequential because the way that ASEAN works is face to face. It's showing up. So if you don't show up, you miss half of it and maybe more. So I think now China is suffering too from COVID, but I think that they are recovering faster, and they have a big domestic market that can be a cushion in these dire times. And moving forward, I'm just thinking that maybe 3 months, 6 months into next year, they'll gain an upper hand. At the same time, I think that now the U.S.-China tension could lead to more conflict, and now it's become kind of a all-around war short of military, not just trade and tech, but culture, visa, students, apart from the rhetoric. So this is an opportunity for me, in my view, that maybe ASEAN can see that, you look at the Philippines, even President Duterte, who was all in on China, even though his policy apparatus was not, even he backed off from the VFA Visiting Forces Agreement of not canceling it. So I think that even the Philippines are having second thoughts. I think that maybe a window of opportunity here where the China-US face-off is going to exacerbate. We will see escalating tensions. Maybe that will be the window that ASEAN can think that, hey, we don't want to go there. We don't want to side with the other side. And in fact, we want to have our own solution. Back to kind of Danny's, supply-demand metaphor. If there's no supply from the U.S., we have to be more self-sufficient in finding our own security, our own stability. Maybe that's the kind of window that will wake up ASEAN, even Cambodia. Margaret.
Great, very, very interesting. I want to run over, but Gwen.
Yeah, it's just that your very good point about Indonesia, but one point I'd really like to make, because I've been closely following the debate and media in Indonesia obsessing about this issue of whether the government should borrow, take on more debt, and absolute knee-jerk reaction that brings back all the memories of the late 90s when Indonesia really, the Asian financial crisis, great sensitivity about taking on debt. Both Thailand also is very reluctant, but is about to launch a nearly 2 trillion baht, which is, well, it's a lot of money, launch an effort to raise that funding. And I think the trouble with ASEAN right now is, I think, with different stages of this COVID, what I call transition, where countries like Vietnam are clear winners and really opening their economy, and Thailand is just moving to that. Indonesia is grappling with rising numbers and very worried about it. But clearly some of these countries are not spending enough, have not made enough funding available, and are under pressure. The IMF, World Bank are advising these countries to take on more debt. And clearly at 42% of GDP, which is where Thailand's debt stands at, they could afford to take on much more and raise it to 60%, as could Indonesia. So I think this crisis is still paralyzing them, and that perhaps explains the slight paralysis in the internal and external dynamics of ASEAN. That was just a point I'd like to make.
Great, thank you, Gwen. Gwen, thank you. As we're slowly getting to wrap up, I'm tempted to have each of you say a parting remark, but it seems to me that what Gwen just brought up about taking on more debt is because, as all over the world, this pandemic has laid bare inequalities and how people without money really suffer the most. So are governments in this region going to start paying attention to the need for the state to help get safety nets, get more public health, improve education, create jobs? Or are they just going to go, well, we're more authoritarian and we'll coddle the elite so we can stay in power? Those are exaggerated choices, but I'm trying to get at what you all think are going to be the long-term this is what ASEAN needs to do going forward? Who wants to start?
I think that I just want to say, Margaret, I think you framed the question very well. Because going into the crisis already, I mean, household debt in Thailand is at 80% of GDP. It's the highest in Asia, I think. Inequality was already a framing argument for increasing levels of unrest, discontent in countries like Thailand and Myanmar. And I would argue also in Indonesia, it's an underlying, I mean, identity politics plays a very important role in some of these countries in channeling this discontent. But profound inequality is very much a driver. And so I think you're right to frame it that way, that the COVID-19 crisis has just highlighted and emphasized the degree to which inequality, which has not been addressed in all these years of development and growth, and where oligarchies and elites have essentially looked after their own at the expense of distributing the benefits of that growth and development in many countries. And Southeast Asia has never been very good at social safety nets. Most countries, Singapore being one, have a sort of a reasonably adequate amount of welfare, but not one that would sort of provide be a serious drain on budgets. And so there's a sort of not quite sufficient, but something is there. And then the question is, will there be more after this health crisis to cope with what Gwen was pointing out earlier as a very important issue, which is the migrant and the migrants and the vulnerable. So I think that's a very good question. I don't think we have the answer yet, though.
Of course, we don't have the answer, but I'm wondering, because we're running out of time. I want to get to everyone. If you give some insight into which path you think is more likely, Professor Danny Quah.
Margaret, if I could just confirm what Michael said about Singapore. Singapore does not have an approach to social welfare as we typically see it elsewhere. Its approach is job creation, job support, job encouragement, not handouts to the unemployed. But having said that, this is a scheme that has fully taken on board the ideals of social coherence and social mobility. So in terms of trying to narrow the gap of inequality, I find that this is an approach that's actually extremely powerful. The second thing I might just say, and then I'll end with this, is that many of the things that are happening with COVID-19 might structurally be already helping in terms of social mobility and flattening income inequality. Now, that might seem surprising because all of us are taken with this image of poor migrant workers stuck somewhere crowded and with COVID-19 running rampant through them. How is that actually helping them? But longer term, what's happening with COVID-19 is that it's rewriting the rewards to economic activity. It's taking away, it's pulling out from underneath the high rents that expensive real estate has always been able to command because of our love for congestion and density. But COVID-19 is saying we don't want that, we don't need that. We move away from a society where this congestion gives rise to superstar economics of rents. And we will pull that away. We will move towards a society that's more resilient because it's the weakest link that needs to be brought up, no longer fetishizing the top 1%. So bizarrely, although we have a difficult time to go through in the short term, longer term, we might be coming around to an economy that's actually more egalitarian because of the structural changes that COVID-19 is putting in place. Back to you, Margaret.
We'll see. We'll see. Professor Thitinan, can we ask you or Gwen to close us out because we've run over?
Okay, very quickly. I mean, you had a very... Gwen can have the last word. So very quickly, I'll just say that, to your very good question, I have a kind of a two-leveled response. The first level is the global international. I think COVID-19 has been another big nail, another major nail in the coffin of the liberal international order as we've known it. I think that's breaking down. It's now been accelerating. There's been an accelerated breakdown. You look at the US, China, you look at China abrogating, you look at US abrogating from its responsibilities, the burdens that it used to shoulder, and you look at China filling in some places, and now you look at the tension between the two. So at the international level, it's becoming like every man for himself, herself, it's like every state for itself. And this is consequential for ASEAN because ASEAN has a neighborhood, has a pretty good, peaceful, and prosperous neighborhood that it can fall back on in a world of every state for itself. My second direction of addressing your question is, the inequality is becoming a reckoning. I think, Gwen and Michael talk about Thailand, inequality, household debt is like 86%, fiscal public debt, we're looking at 58% from 42% after the latest bailout package of 1.9 trillion baht, which is about over $60 billion. But what we're looking at now in these different countries in Southeast Asia is how inequality is being worked out and worked on. In countries like Thailand, it is not being worked on. So you end up with repression, oligarchy. You can think of even the Philippines in the 60s, 70s. So I worry a lot about Thailand. Singapore, 30 years ago, I was a lot more critical. Single party dominant kind of a soft authoritarian state. But now because of the backsliding everywhere else in the region, Singapore, in my book, is at the forefront in being responsive, being accountable, trying to spread the wealth, addressing the inequality. So it depends where you look. But in some places, you'll see more oligarchy, repression, authoritarianism. In other countries where you have, like Singapore, more responsiveness, accountability, you have better answers there. So it's a mixed place, but at the international level, I do hope that this mixed place, this very mixed neighborhood, can still have enough to muster for itself, some growth and some prosperity in the amidst the headwinds ahead in the global arena. Margaret.
Gwen.
Yeah, well, if I may just leap in just very briefly and just try and follow up with those great summing up comments, but I totally agree with Danny on the what might come out of this is a almost forced look at a kind of reform that could lead to more spotlight on these kind of inequalities we're talking about. But particularly, I think this issue I raised about the most vulnerable is that in Asia generally, there is a sort of perception or a tendency to play down or believe that little people do not matter. They are outside the social safety net for a reason. I think it's more pronounced in Asia than elsewhere. So, for example, Singapore, the migrant workers, the fresh wave of COVID took off because they live in such poor conditions. In Thailand, the migrant workers, the stories have been, pretty shocking at some of the conditions and how they have absolutely no rights or support well, many of them don't, and so on and so on. So I think in a way, this whole crisis is going to force these governments to reassess how they relate to the most vulnerable, and particularly these outsiders, their real legitimate role in the economy. In Thailand, they are manning all the construction sites, the back rooms of kitchens. In Singapore, they're absolutely, about 20% or something or more, doing a lot of the dirty, dangerous jobs, and same throughout this region. So I think that could be one thing that does come out of it, and some reality about how and why these countries do still need those, bottom rung workers. And let's not even get to the sex workers and their role here, but I'll leave it at that.
So we've covered a lot of territory. I hope we can reconvene at some point and see whether there has been a great reckoning on inequality and what is ASEAN's role, and has it been boosted by this crisis or not. So maybe we should take a rain check and come back. But thank you. I want to thank everyone. I want to thank Dave Foster for all his technical help. And thanks everyone for joining. And it's an experiment, but it worked. Thank you.
Thank you. Thank you very much. Thank you. Thank you.
Everyone.